Good morning. Today is Saturday. Let's do a little sound check. Testing, testing, testing. Let's do a little sound check. Testing, testing, testing. Okay, everything looks perfect. So time to start our program. So again, today is Saturday. Today is July the 9th, 2022. This is our regular yoga therapy session. We have been doing it for long time, years and years. We have this session in person before pandemic, and the pandemic pushed us to a virtual session. But all the sessions we're doing now is based on our clinical experience and based on our practices which we have done. And based on our practices, we're picking up the topics. Today's topics is yoga therapy for restoration, changing the course of disease. More important is chronic lifestyle related disease. As you see, we spell the disease in English, D-I-S, dis, space ease, E-A-S-E. When your ease become dis, you have a dis-ease, and having a wonderful lifestyle with the effortless ease is the therapy for the chronic lifestyle related disorders. So what is our experience? What is meant by yoga therapy for restoration? Our experience is a practice of yoga therapy. As you all know, yoga therapy is the adaptation of the yoga practices based on patients' or clients' clinical condition. That means we are using the same tool. The philosophy, Yoga Sutra of Patanjali, 196 sutras, of which 193 is how to quiet down your mind. Practices 8 limbs yoga called Patanjali Ashtanga Yoga, 8 limbs. Starts with yama, social restraint, niyama, personal restraint, asana, external and internal alignment for proper function of the organs. Pranayama, prana is a life force, yama is a control or restraint. It's a voluntary regulated breathing. From the therapeutic perspective, pranayama is not a breathing exercise. Exercise and yoga is completely different. Exercise is sympathetic. Exercise creates an increase in the heart rate, blood pressure, respiratory rate. It increases your blood glucose. It causes contraction of your muscles. So basically, it is a fight and flight response or sympathetic response. When you get a sympathetic overdrive, body's homeostasis brings parasympathetic response, and that's what we get the benefit from exercise. On the other hand, yoga practice is primarily relaxation response, activation of the parasympathetic tone. So in a pranayama practice, we call it a voluntary regulated breathing, and we'll show it to you. We do the practice in a effortless breathing. If there is any effort, we lose that therapeutic component. That means you start where you are. And that's what I'm going to show it to you, how yoga therapy is incorporated in our Western medical practice. Pratyahara, fifth, pratta means reject, ahara means input, and the input is not only what we eat, is through all of our five senses. We hear, we see, we smell, we taste and touch. These are all our input, and we learn how to control our input. And basically in yoga, the mind is a content of your five senses. You learn how to control your five senses, you learn how to control your mind. Mind controls your body. Simple yogic statement, metaphorically with a computer. Body is a hardware, mind is a software, and spirit is a programmer. Who does the programming? Yeah, I do the programming. I do the programming of my software, my mind. And once the software has no glitches and the software is working properly, hardware will get fixed. We, on the other hand, as a Western trained physician, we're always dealing with hardware. We're fixing the coronary artery blockage, we're fixing the blood sugar, fixing the high blood pressure. But we never ask back of our mind, what is the cause of this blockage in the coronary arteries? How do I find the root cause so I can literally eradicate this endogenous disease? That's what it comes from, the pratyahara. We'll talk about it a little bit more. Then comes adharan, is a focus. More in focus you do, mind gets more and more concentrated to one point. You do focus with a visual imagery. Then it enters into the seventh limb, which is a meditation, dhyan. So remember one thing, there is nothing called yoga and meditation. Meditation is the seventh limb of yoga practice, and meditation is the phase you want to achieve. Meditation is the medication. In a state of meditation, you are going to create the therapy for the disease, and we'll come about the therapy in yoga therapy practice. A regular practice of yoga will create called rogir chikitsha, treatment of the disease. Then it will create what is called shasturokha, maintenance of health. This maintenance of health creates a environment in our body and mind which causes the primary prevention of a disease. Primary prevention means it is a preventive medicine. So what does it mean? My father has a hypertension, my father has a diabetes, or my mother has hypertension, my mother has a diabetes. I am prone to develop diabetes or hypertension. But the genetic changes I have within my body, which I received from my parents, that gene has to express. And genetic expression today is done by what is called epigenetics. Epigenetics is the effect of environment in our body and mind. So what we have seen today, the practice of yoga therapy is an epigenetics. Practice of yoga therapy is going to reduce that genetic expression, so you are not going to have that genetic expression and the disease, what we are very fearful about. It's a wonderful concept, and we see all the time. Primary prevention, or what we say today is yoga therapy as a preventive medicine, Shastharokha. Then comes what you're talking today, yoga therapy as a restoration, changing the course of the disease. This is called a secondary prevention. What is a secondary prevention is, I have the genetic changes, genetic mutation for the underlying your chronic lifestyle related disorders, and I have been doing everything, disrespecting my epigenetics, disrespecting my environment and the nature, no balance between myself and the universe, what is called balance between microcosm and a macrocosm. In Sanskrit, we call Jatha Pindo Tatha Brahmand. So we're ignoring our relationship with the environment, and we got the disease. We got a sudden heart attack, sudden get a blood pressure crisis, high blood pressure, blood sugar, we're getting a lot of symptoms. We call it a metabolic syndrome. So at that time, we use, which is called integrative medicine, usual and customary practice for the underlying acute condition. For an acute coronary event, or what you call a heart attack, we call it a door to balloon time. That means a person comes to the hospital with a STEMI or acute myocardial infarction. We push them, if they're a good candidate, we take them directly to the cardiac cath lab, do the angiogram, and do immediate angioplasty if it is indicated. The short segmental lesion, and the results will be a phenomenal. If you have a hypertensive crisis, blood pressure is going way high, 250 over 150, we need to start on medication to lower the blood pressure right away. Same as the diabetes, blood sugar is 400, 500, you start on the medication. Then we incorporate this yoga therapy, which is a relaxation response, and your parasympathetic activation. Slowly and slowly we are seeing it causes slow progression of the disease, or many cases even reversal of the disease. On the other hand, you know it quite often that we have a blockage in the coronary arteries and have the immediate therapy, angioplasty, maybe coronary artery bypass grafting called cabbage, and after a few years you get another blockage. Repeat angioplasty, another blockage. Same with the diabetes, under control, then suddenly blood sugar goes high up again. So these, which is called a disease, what is called a metabolic syndrome. It starts from your stress. Stress is a sympathetic overdrive. Sympathetic overdrive first causes the high cortisol level. That cortisol level converts our fat into a sugar into a fat, which is called omental fat. Omental fat is inside my abdomen. It is not outside, not on the skin. Omental fat acts like an endocrine organ. It secretes pro-inflammatory molecule, adiponectin, and it creates a chronic inflammation, which causes blockage in the coronary arteries, called coronary artery disease, or throughout the whole body is called atherosclerotic vascular disease. You get a blockage in the blood vessel in the legs, in the neck, called carotid arteries, a lot of part in the body. Causes diabetes. The insulin is not sensitive enough. It causes hypertension. It causes high cholesterol and also called it dyslipidemia. Dyslipidemia means high triglyceride and a low HDL. It's a very common combination of dyslipidemia, primarily in the Asian Indians living in United States. The very high incidence of coronary artery disease. So, this is called yoga therapy for restoration, changing the course of the disease, slowing down its progression, or even reversal. And many of you know about my story because people who have been attending my class for a long time. I had an open heart surgery 21 years back. And with a daily practice of yoga for the last 15 years, I'm medication-free, disease-free, and enjoying a good quality life. Now let's start with the practice, because that is our most important part of the yoga. People ask me, how do I learn yoga? I say very simple. Keep doing it. Keep doing it yourself where you are. It's a non-competitive. Do the asana practice without any pain. But stay in the asana. Slowly and slowly, a neuroplasticity will set in. You will progress. Do the breathing pranayama. With the effortless breathing, you will have a wonderful recovery from the chronic lifestyle-related disorders. Now, so I cannot sit down in the ground. Sit down in a chair. I have this chair, I keep it all the time. You sit down in a chair. Okay? Let's take a look how you can create or elicit a relaxation response and parasympathetic activation, sitting in a chair, sitting in the ground, or even laying down on your mat or your mattress. When I was doing a live class, there is a person came with 4 back surgeries. She could not even sit down. So she bought a mat. I don't know where she got it, a yoga mat of this thickness. She put it on the ground and she was laying down. And she started the practice, the relaxation response. I showed her how to do the pranayamas. And within a short time means yoga, short time means 2 to 4 to 6 weeks for some people, or maybe another shorter time for other people. She was able to sit up, able to practice. So, what are the components of relaxation response? Let me show it to you first so you will understand. Suppose I cannot sit down in a ground and I can sit down comfortably in a chair. Or I have never done a yoga practice. Now for me, person like me, I had a coronary artery disease, I had open heart surgery, I had a cardiac rehabilitation, and these days we have incorporated a lot of yoga practices during cardiac rehabilitation, and very gently, we start incorporating yoga therapy. Remember, yoga therapy is an adaptation of the yoga practices based on your underlying clinical condition. So the first, if you're able to sit down in a chair, sit down with your spine straight. Merudanda Achal is a primary relaxation response. See, my skeleton, unsupported, will fall in front. My skeleton and my whole body is standing up with a contraction of the muscles around our spine called paraspinal muscles. Anatomical name is quadratus lumborum. So these muscles are in a state of contraction, and I feel two bricks sitting on the side of my spine. But if I made a conscious effort to keeping my spine straight throughout the whole day, starting from the morning throughout the whole day, my paraspinal muscles will start to relax. Muscle cannot stay contracted for too long. And I will feel what I'm feeling now is that I'm feeling two pillows, softer muscles on the two sides of my spine. So if you look at from your perspective, sit in a chair, my spine will always be straight and my feet will be in the ground. Many people ask me, I cannot touch my feet. So put a little bit of a folded blanket. I like a folded blanket because you will develop the neuroplasticity. Your feet is going to come down slowly on the ground. Then you can take out the layers and layers of folded blanket and you can touch it. If you sit down to the back of the chair, if you go all the way to the back and keep your spine straight, that is the way you sit down. That is the level you put your keypad. This is the level you keep your computer. We see a lot of people with a lifestyle-related disorders, what we call metabolic syndrome, in a people who are practicing IT. Because they're always hunchback like this, they're typing on the keyboard and looking at this computer throughout the whole day. So what I tell them, you have to work with the keyboard and the computer, always work with a spine straight. The moment you keep your spine straight, within a short time, you will see a relaxation will set in. And I'll go through with you step by step how to create the relaxation response for a person sitting in a chair who has never done a yoga. That is the credit for a yoga therapist. And as all of you know, a regular yoga teacher training is 200 hours. And yoga therapy training is 800, 1,000, sometimes 1,500 hours. Because that is the reason you're learning. For me, I keep my spine straight all the time. I will sit down in we call it a squatting pose. I will stand against the wall, keep my whole body straight, my head, my back, my hips and the ankle, which is called a Jashthyasana, called a Malajasti, like a stick. That is a part of my life throughout the whole day. That is called my dinocharya. But to keep my back straight, I'm sure you have seen, many of you have seen before, but I'm going to show it to you. This is the tool I use. So you'll be able to see it. Let me show it to you. This is maybe my third or fourth. This is called a kneeling stool. The way to use the kneeling stool is, let me show it to you so you'll be able to see it better, that you sit down kneeling with your down. So what will happen to you is that you are able to sit down. You are able to sit down. Look at my posture. My spine is straight. I don't have any support. No way I can do this and get a hunchback. I have to do it, keep myself straight. Then my second approach, since we are in front of the computer a major part of my day, I keep my keyboard at this level and my screen at this level. So how is it possible? I have a motorized desk. So my motorized desk, if you want to see how the motorized desk works, so here I am at a certain height. So I can keep lowering it. See, if I am lowering you can see my body is going high up. I can go even in a motorized, I can raise my whole table high up, computer going way, way high up. In fact, this can give me even a standing posture. Okay, so I'm going to show it to you. Let me move this light so you understand what I'm trying to say and you incorporate this in your lifestyle. We call it a daily routine. So I was sitting on the kneeling stool. Here I am. I'm going all the way high up. I'm all the way high up. I'm standing up. And that is my laptop in front of me. So the time has come how to keep my back straight. I started lowering it down. My screen is coming down. I sit down on my kneeling stool. Still high up. I'm looking high up now. So come down more. I'm sort of started looking, but still my camera is way high up. Come down more. In fact, from there, I can come down a little bit more. Now, I can tell you now, I'm looking straight into my camera. And my keyboard is here on my hand level. So my back is always straight. Merudanda Achal. Next to Merudanda Achal comes called Manasthir. Manasthir is very simple. Manasthir is quiet down your mind. The first component to quiet down your mind is your hand gesture called mudras. Our hand connects our body and mind. Our hand moves before you can even talk. You find something nice, something good, I will tell you. I'll give you a sign like this before I can say, hey, this was nice. Hey, whatever I put in my mouth was really taste good. If I want something, I'll do this before I can say I want it. And this is extensively done. That hand moves with your mind. So the biggest example is we all talk with our hands. Have you ever seen even a broadcast journalist who will hold the microphone like this when they're talking, their hand goes like this. Yes, I'm telling you, you need to do this. I'm doing this. We are all together. We are going to go there. A hand moves. So the hand gesture called mudras, touching the tip of the index finger and thumb, it is called the Jnana Mudra, Dhyana Mudra, or a meditation mudra. If you go to my YouTube channel, you will see all the mudras. So touch your index finger and thumb, just put it nicely over your knees. I'm showing you all these things because we have used this. We have used this technique for thousands and thousands of times, and we had a large number of patients today who is medication-free, disease-free, enjoying a good quality life. Now, a lot of patient comes to me and says, my doctor wants me to continue the medication. I said, fine. Negotiate with your doctor. How to negotiate? Okay, I have a high blood pressure. I'm practicing daily yoga. My blood pressure is slowly coming down. Going to see my doctor, he says, hey, your blood pressure looks like it's very stable as coming down. In fact, it looks like even lower than what I expected. You know, he or she is a scientific doctor. He or she will, first thing he or she will do, let me cut down the medication a little bit. Say, okay, thank you. Cut down the medication a little bit, continue your whole relaxation response and parasympathetic activation. Go back to see your primary care physician or any physician who go to see. After 6 months, he or she say, hey, blood pressure still looks good. I don't know what you've been doing. Let me cut down the blood pressure medication a little bit more. You are not making any decision because you are not the person who has prescribed that medication. It is your physician. Let the physician be in charge. It's a difference between a modern medicine where physician is in charge, then the integrative medicine where the patient is in charge. You are in charge of your health. Health is a self-care. Meditation mudra, put it here. 5 senses, I hear, I see, I smell, and taste and touch. 5 senses keeps me awake, alert, and active. Because whenever I hear something, I have to turn my head to see where it is. I get a smell of a nice food, I'm going to put the food in my mouth. Out of the 5 senses, most important and most powerful sense is our vision. In fact, eye is our external extension of our brain. Our brain is covered with a skull And eye is the extension because behind the eye is a very large nerve called the optic nerve, and eyes is supplied by three or four cranial nerves. Optic nerve is connected to retina, then called SO4-LR6. Two muscles in the eye, SO4, the superior oblique is supplied by the fourth cranial nerve, lateral rectus, LR6. Lateral rectus supplied by sixth cranial nerve, and rest of the areas of the eyes is supplied by your fifth cranial nerve with the trigeminal nerve, facial branch of the trigeminal nerve. So I close my eyes. The moment I close my eyes, I started bringing the controlling of my mind. Sanskrit called it manasthir. Mind is still very active. Remember, mind quiets down in a state of meditation. And what is a meditation? Normally, we generate thousands and thousands of thought processes. Most of our thought process is in the past. All the time the thought comes, wow, why you have done this? Wow, what happened to her? Why he did it to me? All thought process in the past. Majority of the thought process also is in the future. What will happen to me? What will happen to my family? Yeah, I'm going there. What is going to happen? Very little thought in the present. In yogic lifestyle, you live in present. Yesterday was history. Tomorrow will be a mystery. Today is the present, the gift, and take it. So out of all the thought process which are even in the present, a large number of thought process is your repeat thought process. I need to come. I need to talk. I need to do this Facebook Live program. From the morning, it was chattering. It's like a chattering of a monkey. In the meditative state, you enter in between the thought process. It's a space called a gap. Slowly and slowly you expand the gap. So thought process still remains, but the repeat thought process goes away. The mind doesn't chatter anymore. Start creating a relaxation response. It is like a fall. Your mind was like a Niagara Fall. Now it became slowly becoming a river. From the river, it will be like a pond. There will be no ripple. You'll be able to see the bottom of your pool or a pond because the mind is calm and quiet. When you close your eyes, your mind is still chattering. Best way to quiet down your mind is incorporating the breath-centered meditation. What does it mean? You bring the power of visual imagery. You start visualizing your breath. Bring your whole concentration just outside your nose. So your mind, instead of any other thought process, mind is now concentrating outside my nose. I breathe out first. The reason being, My lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to stay open, like a balloon. With 4.5 liter air or a carbon dioxide or impurities in the lung, which you can exchange. Normal breathing, which is called tidal volume, we only breathe 500 cc, half a liter. So 80 to 90% lung function we have a reserve. But since the lung is full of all the carbon dioxide and toxic air, if we breathe in, all the airs are sitting in the top of the dirty air. All the air sitting between nose and your throat and the trachea and the upper part of your bronchioles, those are called dead space. Oxygen only gets exchanged when the oxygen reaches the alveoli, all the way to the end of the lung. So for all yoga practices, breathe out first. Then you visualize your breath just outside your nostril. Now you visualize your breath is coming in through your nose. Visualize all the outside air is getting filtered inside your nose. Nose is your personal air conditioner. Outside air is warm, it's going to cool it down. Outside air is cold, it's going to warm it up. Air enters the side of our nose, those called turbinate. Turbinate are like a channel. Air flowing through the turbinate creates a vortex. This vortex moves over the mucosa of your sinuses. This sinuses opens in your nostril. Maxillary sinus, frontal sinus. When that air goes over the mucous membrane, it secretes a substance called a nitric oxide. Nitric oxide is a potent vasodilator, keeps your blood vessel open. Nitric oxide is known to cause the maintenance of endothelial health. Endothelium is inner lining of the blood vessels. Today, with all of our scientific medical knowledge, we know once your endothelial health is optimal, your whole body and mind health is optimal. Nitric oxide also known to activate your parasympathetic tone. Parasympathetic tone is mediated through nitric oxide, cyclic GMP, acetylcholine. You are still visualizing the air. The vortex is coming behind your throat. Vortex is slowing down now, is entering into the larynx. The moment you breathe through your nostril, all the air enters into your larynx and the trachea. So always breathe in through your nostril. Do not breathe in through your mouth. If you breathe in through your mouth, you have no idea where the air has gone. Maybe half of them has gone to your stomach, half of them in the lung. So always breathe in through your nostril, breathe out through your nostril. We always hear this. I have to use my mouth to breathe. In that situation, you breathe in through your nostril. You can breathe out through your mouth. More physiological. Now, in your breathing pattern, always after breathing out, when you breathe in effortlessly, which I'll show it to you a little later, you breathe out longer than breathing in. Now you're visualizing your breath entering into the upper part of the lung, middle of the lung, lower part of the lung, almost to the level of your belly button. Lower part of the lung and the abdomen is separated by a muscle called a diaphragm. When diaphragm is relaxed, the lung drops down almost to the level of your belly button. Normally, your breath automatically gets stopped in this area. It's called a Kebul Kumbhak. Then visualize your breath leaving that your belly button area, entering lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through the nostril and coming out through both the nostril equally outside your nose. Outside your nose, it picks up a subtle energy called prana. Prana is a subtle energy which cannot be measured. It keeps us awake, alert, and alive. Prana is not your breath. Metaphorically, prana is like an electricity. Breath is like your electric cable. In yogic tradition, your whole body does breathing, not only your lung. Skin does breathing. Every organ, liver does breathing, kidney does breathing. So you can breathe in the prana to the organ of healing. It is called a pranic healing. I have a heart problem, I visualize my prana is coming to my heart. A back problem, you visualize prana coming to your back. With diabetes, you visualize prana in your pancreas. Prana does the healing. Now with your spine straight, with a hand mudra, eyes closed, your mind is quieting down to the point that you start doing little gentle, effortless breathing. Breathe out first. Breathe in with a count of 2 in. 1 and 2 in. Breathe out with a count of 4 out. 1 and 2 and a 3 and a 4. You can do it very easily. You are extending your exhalation and extending your breath. Inhalation is sympathetic, exhalation is parasympathetic. You are creating a parasympathetic response. In the process of prolonging your inhalation and exhalation, you are reducing your respiratory rate. Normally, our breathing rate is 15 to 16 per minute. You can easily do count of 2 in, count of 4 out. That means 2 seconds in, 4 seconds out, with a cycle of 6 seconds. Your breathing rate has already dropped down to 10 per minute. After a short time, you'll see you'll be able to do it. Remember, you do it effortlessly. Effortlessly means you can talk, you can even sing. There is no huffing or puffing. There is nothing called breathing exercise. It is called voluntary regulated breathing. You can easily go up to 4 seconds in, 8 seconds out. If you can do 4 seconds in, 8 seconds out, a respiratory cycle of 12 seconds, the breathing rate has already dropped down to 5 per minute. We've been practicing so long, we can easily do 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out, even 10 seconds in, 20 seconds out. If you practice it for a while, you develop neuroplasticity. That means habit forming. That's how you'll be breathing. That's how you'll be breathing when you're even sleeping. When your breathing rate comes down, you live longer. Extend your exhalation, extend your longevity. As simple as is. If you look at animal world, a dog breathing 30, 40 breaths per minute lives only 18, 20 years. Turtle breathing 3 or 4 breaths per minute lives 100, 200, 300 years. And the way we explain is that God gave us a fixed number of breaths. If we use it too fast, we just go early. If we use it slowly, you live longer. Again, we have been practicing for so long. When we sleep, our exhalation is still longer. Then we also have abdominal breathing. Abdominal breathing is like a baby. It is very relaxing and calming. So just show you an example. Let me show you the gradual increase in the breathing cycle. In the meantime, I can tell you, I am having a saliva in my mouth. I've been talking to you almost an hour, but my mouth is still wet. My mouth has a salivary secretion. Your mouth gets dry when you hear bad news, or when you have a fearful, or you are giving a big talk in front of an audience. That is called sympathetic overdrive. In sympathetic overdrive, your mouth gets dry. Parasympathetic activation, your mouth is wet. All my mouth is wet. My tongue is wet. All muscles of respirations are very relaxed. I can show you count of 4 in, count of 6 out. Breathe out first. Count of 4 in. Count of 8 out. Very easy for us because we've been doing it for a long, long time. We can easily show it to you. Count of 8 in, that means 8 seconds in and 16 seconds out. Let me show you one example so you'll understand what I'm talking about. We've spent time with your yogis in India. They will sit down next to you. They will breathing maybe 2, 3, or 4 breaths per minute. It is so slow, so quiet. You don't even know they're breathing. So breathe out first, a long breathe out first. Okay, I won't talk anymore. I will do a long breathe out first. I'll do 8 seconds in, 16 seconds out. Just 8 seconds in, 16 seconds out. When you come to this state, your whole body and mind get completely relaxed. Yoga therapy is holistic. That means your whole body and mind works together. It is not reductionist. That means I'm trying to relax my neck. Neck will get relaxed. It is not. When you can incorporate this breathing and sit down and do it for a while and do it until you have any effort and then you stop. We have seen so many people who does this. They go home and they say, oh my God, my blood sugar never dropped down below 140. Now I'm home, my blood sugar is 80, blood sugar is 90. We get it all the time. My blood pressure now is a lot lower than what it does normally. From here, you practice a couple of other practices which will bring a profound relaxation response. Is that you learn relaxation from your babies. Your babies are all relaxed. So if you look at a baby, how they relax their hand, baby relaxes their hand with a fist called baby fist. You always do a fist like this, but the babies will put a thumb inside and close. That is your baby fist called Balo Mushti Mudra, called Adhi Mudra. Also, when hands are relaxed, you see how my fingers are all separated. You can put your hand both sides. Before, if they're not relaxed, they're very tight. You can even practice with your breathing. You can put your hands outside, you breathe out first. Take a deep breath in, breathe out, and do a baby fist. Look at thumb inside and close. All the pains will go from your hand. If you have a pain in your hand, do this called Balo Mushti Mudra, Adhi Mudra. Breathe in, breathe out. Breathe in, breathe out. You continue for a while, but because of time's sake, I can show it to you. Your wrist gets relaxed with extension, tightens up with a flexion. So breathe in, breathe out. Breathe in, breathe out. Your muscles of the breathing are through skeletal muscles which you can train. Like if a skeletal muscles here, you can do 5 pounds, and after a while you can do a 10 pounds, you can do 15 pounds. Same way you can breathe. 3 seconds in, 6 seconds out, 4 seconds in, 8 seconds out, 5 seconds in, 10 seconds out. It will happen to you. It will happen more if the muscles are more relaxed. And the muscles are relaxed with called prayer pose to the back, called Prashim Namaskar. So let me show it to you how easy it is. Let me turn around so you will be able to see properly. Let me see. You can see here my back, hopefully. Yes. What you do is called a Prashim Namaskar. It slowly bring your hands wherever it starts. You have to start where you are. If you're here, stay here. Slowly breathe out, longer than breathing in. Your hands will join. Again, after some time, your hands will get into a prayer pose. It is a profound relaxation response. You will start seeing your saliva is in your mouth. Now you continue, breathe out longer than breathing in without any effort wherever you are. If you can do 2 seconds in, 4 seconds out, continue. After a few weeks, you'll get into 4 seconds in, 8 seconds out, and you'll see your hand will go high up more. So that creates more relaxation. Stay here a little longer and longer. Your hands will keep on going high up more and more. We practice every single day. This is our profound relaxation response. In this state, at least I can share with you, my breathing is totally effortless. My breathing is through both the nostril. A profound level of relaxation. So, this simple practice to start with, spine straight, Merudanda Achal, hand gesture, mudras, manasthir with your eyes closed, focusing on your breath, exhalation longer than inhalation. If you can just incorporate this in your practice, daily practice first thing in the morning, you will see a profound changes in your body and mind. Then you'll request you to incorporate yogic lifestyle. Always keep your spine straight. In the morning, if you're able to sit down in a squatting pose, drink a glass of water at a first bowel movement, then your tongue scraping and the jal neti part, washing your nose, which you do every single day. So let me show you 2 other practices which you can do after this. And in the meantime also, when I was doing even this mudra, I could feel in the meditative state the sensation of my fingertip was going down. I was able to feel the capillary pulsation of this. So the most important effect after able to breathe out longer than breathe in, you start doing a breath holding. Breath holding in inhalation, breath holding in exhalation. Breath holding in inhalation, lungs starts to expand slowly and slowly, but we have a rib cage, cannot extend any longer. Then on the surface of the lung, there is a nerve endings, which creates a reflex, which is called Herring-Brewer reflex, which is the activation of the vagus nerve. Activation of the vagus nerve is activation of parasympathetic tone. Then you incorporate a lock called your Jalandhar Bandha, chin lock. Breath holding in inhalation called Abhantarin Kumbhak. Kumbhak is the breath holding, and the chin lock called your Jalandhar Bandha creates a special pranayama practice called a Murcha pranayama. Murcha basically means unconscious. That means you are so relaxed, your blood pressure goes down. We always do with our actually health tracker. I forgot to put it now, but I use it all the time with Apple Watch, which you have seen most of the time. Then you do breath holding in exhalation. Breath holding in exhalation creates a negative intra-abdominal pressure, which is called your Uddiyani Bandh. Bandhas, Jalandhar Bandh, chin lock, Uddiyani Bandh, abdominal lock, then is called your root lock, Mula Bandh. You contract your pelvic floor and pull it up. Bandhas are such a powerful therapeutic component. When I even lived with the yogis, we find out no yogis will live home without a bandha practice. Including all of us, we don't even leave home without practicing bandhas. We always practice bandhas. Then alternate nostril breathing, called Anulom Vilom Pranayam. Left nostril is controlled by the right brain, and right nostril is controlled by the left brain. The right brain is cooling, intuitive, parasympathetic. Left nostril is called the Chandranari, moon energy. Right nostril is controlled by the left brain, which is analytical, heating. Sympathetic is called Suranari, sun energy. It activates both sides of the brain. And we'll show it to you when you are in a total relaxation response, yoga therapy for restoration. You will be able to do it without even closing your nostril. So these two practices, very simple. A relaxation also comes from Dhanu Mudra or Ganu Mudra, also Adhi Mudra. Generally, I've been doing it with Adhi Mudra. My hand goes into Adhi Mudra very easily. So you will see a practice, Murcha Pranayam, breathing out first, take a deep breath in, hold my breath, and slowly drop my chin down towards your chest, creating chin lock or Jalandhar Bandha, and stay as long as I can without any effort in breathing. Breathe out first. Take a deep breath in. Hold your breath. Drop your chin down close to your chest and still keep holding your breath. Just for the documentation, I can show it to you. My whole mouth is full of saliva. I have not taken any water at all. Parasympathetic activation, profound relaxation response. If you can continue a few times, it'll be wonderful. Then you do breath holding and exhalation. It's your Uddiyana Bandha or abdominal lock. The technique is breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. I was also incorporating the chin lock with the abdominal lock. In fact, we do all the three locks together. Root lock also, contracting your pelvic floor and pulling it up, and anal canal constricting anal sphincter and pulling it up and hold it. It becomes like it's called a great lock, Mahabal. These are time tested, money back guarantee, non-pharmacological therapy for chronic lifestyle related disorders. You also can do what is called the Agni Sarca. You pull it, the abdominal wall, all the way back in, then you massage all the internal organs. After your vital organs, all the disease stays here in your abdomen. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and move. They're called Agni Sarca. Normally, a lot of teachers will tell you these are very advanced practices. Be careful. Pranayama, you need a teacher to guide. Yes, you need everything. But the moment you listen to your body's signal, the moment you do every practice with no pain, effortless breathing, as if this is your normal breath, you can talk, you can sing, you can perform, you won't be able to hurt yourself. Normally, in a meditative state, you can access your subtle body. We have three bodies: gross body, which connects to your body, then your subtle body, which connects with your mind, and a causal body which connects with the spirit. Your gross body could be here, your subtle body could be somewhere else. Here I am. I'm in my home. Gross body is here. I was traveling. Last week I was traveling during 4th of July. So I'm clearly visualizing my body is in my car. I'm driving down I-95, and I can clearly access any part of my body. Here I am with my eyes closed. Because this is the body of my mind, I have been looking at this body in thousands and thousands of times, so I can clearly touch the tip of my nose with the eyes closed. I touch the top of my head. I touch the left index finger. I touch the left thumb. I can touch my left great toe. So I can access any part. Same way, I will be able to access the alternate nostril breathing without closing my nostril, which most of you do. So sit down. This is called meditative alternate nostril breathing. Remember, the 8-limb practice is designed to enter your step by step from asana, pranayama, pratyahara, control of your senses, dharan, focus, then dhyan, the meditation. Touch your tip of your index finger and thumb, put it over your knees. Bring your awareness to the tip of your nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. If you're practicing with me, your eyes are closed and you are in a state of silence. Silence also controls your 5 senses and brings meditation. In your silence, let's practice alternate nostril breathing without closing our nostril, entering into a meditative state. I'll give you a little cue. We'll do very short practice because this is just to show it to you. I'll give you a cue and that will be the end of our practice today. Slowly bring both of your hands in front of your heart. It's called the heart chakra, anahata chakra. Touch your little finger and the thumb. Separate ring finger, middle finger, and index finger. This is called a Padma Mudra, Lotus Mudra. It connects your body, mind, and spirit. Slowly bring it close to your heart. Heart is the site of your soul. Heart is connected through your mind. In our normal conversation, we say, memorize by heart. We know heart is connected through your mind. We memorize in our mind. This simple practice of relaxation response, activation of parasympathetic tone, is the fundamental medication for changing the course of your chronic lifestyle-related diseases. This is yoga therapy for restoration. Your progression will be slower and it will reverse your chronic diseases. You finish with the pumping and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove the glasses, then take both the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Heat in the eyes relaxes the ciliary muscles. Ciliary muscles are tight. It controls the lens, tightness of the lens. But relaxation of the ciliary muscle relaxes the lens. Convexity increases. It acts like a reading glass. We don't need a reading glass when you do this. Slowly massage your forehead. Massage your eyes. Massage your face. All the muscles in the face are attached to the skin. The muscles are relaxed. All the lines goes away. Your frowning goes away. You look younger. Skin looks more tightened. This is called your tejas, the auras. Slowly take your hand, massage the earlobe, behind the ear, in front of the ear, even inside your ear, external ear. There is a nerve called the auricular branch of the vagus nerve. It stimulates the vagus nerve. Take your hand and massage in the side of the neck called carotid sinuses. Carotid sinuses also gets activated when you do a chin lock, Jalandhar Bandha. Massage of the carotid sinus we do for supraventricular tachycardia. It quiets down your cardiovascular system and nervous system. Take your hand behind, massage near the occipital tubercle to the insertion of the trapezius and sternocleidomastoid muscle, both the muscles supplied by cranial nerves. Bring your hands in front in a gesture called Namaste. I honor the divinity within you and my underlying chronic lifestyle-related diseases will have a slow progression or reversal to maintain a medication-free, disease-free, a quality lifestyle. So wonderful practice, wonderful way to introduce yoga therapy to a person who probably has never heard of the word yoga. They've been taking a tons of medication. Now the doctor is recommending yoga therapy and you are helping that person. As I said, as long as I'm in town, to continue this Saturday morning class. Now, people say that the incidence of COVID-19 is going up again, but the virulence of COVID-19 is a lot less. It is more contagious, but less virulent. The Omicron is causing a laryngitis, cough, your hoarseness of your voice, but it is not going down to the lung like what it did in 2020. Delta variant can cause a little bit of alteration of your smell and taste, but overall, hopefully, overall, what you're looking at, less hospitalization, less morbidity, less mortality. So people started doing now in-person conferences and sessions. Getting a lot of invitation. Just did one session in San Antonio in person the week before last Saturday. Just got an invitation to a presentation in New Jersey in August, third weekend of August. And hopefully we'll be able to go there. And again, please continue a daily practice. You will see a wonderful, wonderful change in your body and mind. Any questions you have, please send it to me. We all do it through the Facebook, and I'll be able to answer all of your questions through the Facebook. And next Saturday is what, 9th, okay, 16th, I'm here. So we'll be here the next Saturday, we'll have a class. See you soon. Bye-bye.